For 44 years, St. John's Well Child and Family Centers have served the health and medical needs of the families of South Central Los Angeles. Now, the Healthy Homes, Healthy Kids program will allow them to do even more.
This is our dream program. The Healthy Homes, Healthy Kids program will allow us to fix the problems which are affecting the health of our children, to eradicate their asthma, to bring their lead poisoning levels down. The slum housing in which our children live in South Los Angeles is making them sick.
Since 1997, 3 community organizations, led by St. John's Well Child and Family Center, have worked together.
And working closely with our long-held collaborative partners, Strategic Actions for a Just Economy, which provides tenants' rights support and tenants' clinics, and Esperanza Community Housing Corporation, which provides community health promotion and education, home intervention services, and affordable housing.
The Healthy Homes, Healthy Kids program will take a 3-pronged approach to improving the lives of children in South Los Angeles. Step 1. Address the immediate health care needs of the community by providing proper medical care and education.
Well, it was hard because in the night I would see her crying or shortness of breath and I didn't know what to do. I just kept giving her home medications, and until one day that I saw that she was unable to breathe. And then I got worried and I took her to the hospital. And they told me that she was diagnosed with asthma.
They live in slum housing. That means cockroaches. Cockroaches, we know, is probably the #1 trigger for asthma. Another trigger for asthma is moles.
I get a lot of mold.
¿Cómo tiene así? La cosa mira así. Y mira la pared. Por ahí ya la almohada, por eso pongo aquí es pelado, porque ahí le agarra la maldad.
And what does your mom use those for?
For the wall, the black things. To clean?
To clean the mold?
Yeah.
Well, at the beginning I didn't have no insurance because St. John's people helped me to get Medi-Cal. I was able to get the medication for free.
Step 2. Addressing the living conditions that are making children sick by sending trained community members into their homes.
The promotores de salud, the community health promoters, are all community members. So they are the ones that have the greatest stake in making this neighborhood a safer place for children.
I grew up in South Central, and I think it's easy for me to relate and to find the solution.
St. John sends the referral to us. We make an appointment, then we go to the houses. We do an interior inspection of the house.
When we go into a home, we kind of become detectives.
Buenos días.
We automatically detect the chipping and peeling paint, the roaches, we see the mold.
El baño que escurre agua, eso, que ya tenía como, pues ya la han reparado como unas 5 o 6 veces.
Sí.
Se humedece cuando cae agua de arriba.
Sí.
We see the kids with asthma or a lot of children with allergic reactions.
St. John's was on the cutting edge when they start sending promotores to our patients' homes. All of a sudden, our patients start doing better.
There's so many things that we can do at a very inexpensive price to make our children healthy.
They're low tech, but they make a big difference.
Step 3. Empowering individuals to work together as a community to change the conditions that are affecting their families' long-term health.
Ahí, ¿qué está pasando?
Anteriormente que había venido a la reunión igual lo del plomo. Entonces yo tengo a mi bebé y desde todo nomás lo único que van a hacer es quitar la que está descascarándose y volver a aplicar.
At least 50 to 60% of our kids, when we test them for lead, test positive. And that's a direct result of where they live. Lead is a neurotoxin, and that directly correlates with their ability to learn.
We have St. John's let us know when they have cases of elevated levels of lead in the blood because there are, as you know, very specific health consequences.
By taking a holistic approach to case management, St. John's understands that healthcare starts in the clinic, but continues in the home. And studies show it's working. Since the program's inception, St. John's has seen a 95% reduction in the blood lead levels of its pediatric patients, and a 100% reduction in asthma hospitalizations.
We've had tremendous success in developing this project in particular areas, and what we really need now is support to roll it out across South Los Angeles.
As a parent of a 5-year-old, there's nothing more important than the health of our children. And St. John's is providing the data, the impact. And so the data that they provided to me led my office and myself to introduce a motion in the City Council to effect legislative policy as to how our City Department of Building and Safety is implementing some of the laws we already have in the books, and even more so, how we can do it better.
The Environmental and Chronic Disease Center, which we've just completed, it's really quite exciting because it'll allow us to bring all of the kids in to have comprehensive care under one roof. And it will allow us to bring together all of these different services that we provide. Every child has a human right to health. We have the model, it's successful, it works. We can alleviate asthma symptoms, we can alleviate missed school days, we can alleviate missed work days for the parents, we can have children live normal lives, we can bring down their lead poisoning levels. We can do all that, but we do it because of the limited resources in limited areas. Imagine what would happen if we could literally improve the health of every child in South Los Angeles.